Hello everyone, this is Medical Gateway, and in this part we're going to study regarding the stages of erythropoiesis. So let's start it. So from where the red blood cells are produced, or exactly where the erythropoiesis takes place. So you all know the answer, that the red blood cells are formed in the bone marrow. Okay, but this is not the case in the gestational life. So in early weeks of gestation, the red blood cells are produced from the yolk sac, whereas in the middle trimester, the red blood cells are produced from liver, spleen, and lymph nodes. And then in the last months of gestation, the red blood cell production starts from bone marrow of all the bones. Okay, so the RBC production from the bone marrow of all bones basically begins in the last months of gestation. So in early weeks of gestation, the production is from yolk cell. In middle trimester, the production is from liver, spleen, and lymph nodes. When the last months of gestation, the production starts from bone marrow of all bones. Okay, now, so up till when the production continues in the bone marrow of all bones? So from last few months of gestation till the baby is 5 years old, the production of RBCs is from bone marrow of all bones. Okay, from 5 years till 20 years of age, the production of RBCs is from not the bone marrow of all bones, but the bone marrow of membranous bones and proximal portion of humeri and tibia. So from the age of 5 years till the age of 20 years, the RBCs are produced from the bone marrow of membranous bones and from the proximal portion of humeri and tibia. Okay, and after the age of 20 years, the RBC production is done by the bone marrow of membranous bones only. Okay, so when the person is of the age greater than 20 years till death, the RBCs are not produced from bone marrow of all the bones. RBCs are only produced from bone marrow of the membranous bones. So which bones are exactly the membranous bones in body? The bones which are producing the RBCs after the age of 20, basically after the age of 5, are the bones involved in the rib cage. The ribs, now ribs are attached behind to the vertebra, and the ribs are attached in front of the sternum. So it's the bones involved in the rib cage are involved in the RBC production, are involved in the erythropoiesis after the age of 5, and basically solely after the age of 20 years. Okay, so I'm going to just quickly revise this because it's very important. This is at times this is asked in the MCQs. So in the early weeks of gestation, RBC is produced by yolk cell. In middle trimester, RBCs are produced by liver, spleen, and lymph nodes. From the last months of gestation till 5 years of age, RBCs are produced by bone marrow of all bones. From the 5 years till 20 years, the RBCs are produced by membranous bones as well as the proximal portions of humeri and tibia. And after the age of 20, they are produced only by the membranous bones. Okay. So now, what exactly are the pluripotent hematopoietic stem cells? So all the blood cells, no, we're not just talking about the red blood cells, we're talking about all the blood cells, which include the white blood cells, the platelets, and also the lymphocytes, which are included basically in the white blood cells. So the platelets, the WBCs, the RBCs, all are formed basically from the pluripotent hematopoietic stem cells. Now, pluripotent hematopoietic stem cells are the cells which can be converted, which are finally converted into the colony-forming unit spleen, and then colony-forming unit spleen will be converted into the respective colony-forming units of the platelets, WBCs, and RBCs. So, pluripotent hematopoietic stem cells are converted into colony-forming unit spleen, And then colony-forming unit spleen will be differentiated into further 3 types of colony-forming units. One colony-forming unit will give rise to platelets. The other colony-forming unit will give rise to WBCs, and the third colony-forming unit will give rise to red blood cells. The colony-forming unit, which is giving rise to red blood cells, is known as colony-forming unit erythrocytes. And the colony-forming unit, which is giving rise to white blood cells, are known as colony-forming unit granulocytes and monocytes. Now, what is this granulocyte and monocyte? These are the types of white blood cells. So there are 2 types of white blood cells. One having granules are known as granulocytes, whereas the other ones are agranulocytes. So from there the name came, the colony-forming unit granulocytes and monocytes. Monocytes are basically agranulocytes. So this is the name. And the colony-forming unit, which will give rise to platelets, are known as colony-forming unit megakaryocytes. Okay, so these 3 will be formed from colony-forming unit spleen. Just there is one additional point, that before colony-forming unit spleen, there is also a stage which is colony-forming unit blast. So colony-forming unit spleen will give rise to colony-forming unit blast, and colony-forming unit blast will give further rise to colony-forming unit erythrocytes, and then colony-forming unit erythrocytes are giving rise to our red blood cells. Now, basically, what is happening, that behind we have pluripotent hematopoietic stem cells. Now, these cells are growing and multiplying, and basically also these cells are differentiating into different types. Okay, so there are 2 things which are happening. One is growth of the cells, and the other one is differentiation of the cells. So for the growth and the differentiation, we need some supportive substances. So for growth, we have growth inducers, and for differentiation of cells, we have differentiation inducers. Okay, so growth inducers, we have the most important growth inducer is interleukin 3. So interleukin 3 is a growth inducer. Okay, cell is growing as well as the cell is differentiating. The cells are differentiating. So we have growth inducers and differentiation inducers. Okay, so the most important growth inducer is interleukin 3. Okay, so this is the whole story. Now, I've just left one thing. In the WBCs, we also have lymphocytes. Okay, but for the lymphocytes, we have a separate lineage. The pluripotent hematopoietic stem cells are converted into lymphoid stem cells, and these lymphoid stem cells give rise to lymphocytes. Okay, so this is how the pluripotent hematopoietic stem cells are giving rise to each and every kind of blood cell. Okay, now let's move to a main topic, the stages of erythropoiesis. Okay, now the stages of erythropoiesis means the stages by which finally a mature red blood cell, which is known as erythrocyte, is formed. Okay, so mature red blood cell is known as erythrocyte. So these are the different stages of formation of a mature red blood cell, the erythrocyte. So the stages are, the first stage is, the most immature stage is proerythroblast. Then we have basophil erythroblast. Then we have polychromatophil erythroblast. Then we have orthochromatic erythroblast. Each of this stage has the name erythroblast in it. One is pro, then we have basophil, then we have polychromatophil, then we have orthochromatic. Okay, so these all are erythroblast. Then erythroblast will be converted into, these orthochromatic erythroblasts will be converted into reticulocyte, and then reticulocytes will be converted into the mature RBCs, erythrocytes. All these stages are taking place in the bone marrow till the orthochromatic erythroblast. Then in the bone marrow, the reticulocytes are formed, and then the reticulocytes finally enter from the bone marrow into the circulation, and in the circulation the reticulocytes, which are also the immature cells, are converted into finally the mature red blood cells. Okay, so these are the stages. Okay, now if we look at the characteristics of a mature red blood cell, the erythrocyte, then we'll come to know that the mature red blood cell have hemoglobin in it. 1 point. Second one, the mature erythrocyte, the mature RBC, does not have nucleus in it. The nucleus is absent in the mature RBC. And the third point is the mature RBC also doesn't have mitochondria and ribosomes. So you have to remember 3 points. Mature RBC has hemoglobin, but it does not have nucleus, mitochondria, and RBCs. If we look at any cell, the cells have nucleus, the cells have mitochondria and RBCs, but any cell, the cells doesn't have hemoglobin. So when we have to start our story from erythroblasts, proerythroblasts, the proerythroblasts have nucleus, it doesn't have hemoglobin, and it does have the mitochondria and ribosomes. Okay, and as the stages are being matured, these immature RBCs will get rid of the nucleus. The hemoglobin will start appearing, and it will get rid of the mitochondria and the RBCs. Okay, so in the stages we have to focus on 3 to 4 things. These stages are very easy. We have to focus that in which stage, whether the nucleus is present, whether hemoglobin is present, or whether mitochondria or RBCs are present or absent. Okay, so finally in the mature form, the nucleus will be absent and the mitochondria and RBCs will be absent and the hemoglobin will be present. But in the first stage, the condition is reverse. Nucleus is present, mitochondria and ribosomes are present, but the hemoglobin is absent. So this is proerythroblast. Okay, nucleus is present, nucleoli is present, hemoglobin is absent, and mitochondria and RBCs are also present. Then we have basophil erythroblasts. In this stage, nucleus is present, but the nucleoli is absent. Now, the story is moving towards the disappearance of nucleus and the appearance of hemoglobin. Okay, now, it will be easier for you to remember if you focus on the words. Basophil, orthochromatic, polychromatophil. Now, basophil. The term basophil comes from the basophilic staining. Now, we have eosinophilic staining and the basophilic staining. The eosinophilic staining was pinkish in color, whereas basophilic staining was purplish or bluish in color. Okay? Now, if you remember which part of the cell gets stained by a basophilic stain. So the nucleus is always stained by a basophilic stain. That's why I have labeled all the stages where the nucleus is present as blue, and all the stages where the hemoglobin is present as pink. Okay, so in basophilic, the basophil erythroblast is known as basophilic erythroblast because it is stained with a basophilic dye, because it has nucleus in it. Okay, so but now as we move towards the next stage, the polychromatophil erythroblast, now the hemoglobin starts to appear. The nucleus hasn't disappeared yet, but the hemoglobin has appeared. Now this erythroblast is having nucleus and also is having the hemoglobin, because hemoglobin has appeared here. So now this erythroblast will be stained by a basophilic stain as well as an eosinophilic stain. So basophilic stain will give a bluish purplish discoloration of the nucleus, whereas eosinophilic stain will be because of the hemoglobin getting stained by eosinophil. So as this stage is stained by more than one color, then because of it, its name is polychromatophil. Chromatophil is from the term chrome, and chrome is from colors. So it's polycolor, the stage having polycolors. The stage which is stained by polycolors is known as polychromatophil erythroblast, because nucleus is stained by basophil in this, and hemoglobin is stained by eosinophil in this. And in this stage, both the nucleus and the hemoglobin are present. Okay? Then we have orthochromatic erythroblast. Now, in this stage, the nucleus is lost. The nucleus is lost. Now the nucleus is not present, and only the hemoglobin is present. So this stage is known as orthochromatic erythroblast. That's why I've labeled it pink, and here it's also pink. So the point from where the nucleus is absent, the bluish highlighting is absent. Okay. So basophil has only hemoglobin. Orthochromatic stage has only the basophilic stage has only nucleus. The orthochromatic stage has only hemoglobin, whereas the polychromatophil stage has both the nucleus and the hemoglobin. Okay? So nucleus has disappeared from the orthochromatic stage, whereas hemoglobin has appeared from the polychromatic stage. Okay, so in some parts, even the Guyton, it is said that in the proerythroblast stage there is little hemoglobin present, but that hemoglobin is not stained, but the hemoglobin is properly appears and is stained from the polychromatophil stage. Okay, so I've just labeled that from the polychromatic stage the hemoglobin appears. Before that, in some books, at some points, even the Guyton, it is written that hemoglobin does appear to some extent, but it is not being stained. Okay, so the nucleus has disappeared. The nucleoli disappears in the first stage, or is only present in the first stage, and disappeared in the second stage, the basophil erythroblast. Whereas the nucleus disappears in the orthochromatic stage. Okay. And then we have hemoglobin present in all the stages, and nucleus is absent in all the stages. Okay. Now, how exactly the nucleus is lost from the cell? The nucleus is basically destroyed or basically degenerated by three mechanisms: by pyknotic degeneration, by karyolysis, and by karyoresis. Now, what exactly is pyknotic degeneration? Pyknotic degeneration means the nucleus shrinks and the nucleus goes from condensation. So shrinkage and condensation of the nucleus is known as pyknotic degeneration. Whereas there is lysis of the nucleus because of the swelling. So karyolysis involves the swelling of the nucleus, whereas karyoresis involves the degeneration of the chromatin. Okay, so if someone asks that how the nucleus is lost, you will say it by three mechanisms: the pyknotic degeneration, the karyolysis, and karyoresis. Pyknotic degeneration involves the shrinkage and condensation, karyolysis involves the swelling, and karyoresis involves the degeneration of the chromatin. Okay. So finally, we have the orthochromatic stage where there is no nucleus, no nucleoli, we have hemoglobin. Okay. Then there comes the retic stage, the reticulocyte stage. Okay, now the reticulocytes are present in the bone marrow. So when the reticulocytes are produced, the reticulocytes stay in the bone marrow for 2 to 3 days. And after 2 to 3 days, these reticulocytes will move from bone marrow into the circulation. Okay, and there the reticulocyte in the circulation stay for 24 hours, and after that the reticulocytes are converted into the mature erythrocytes, the mature RBCs. Okay, so reticulocytes are present in the bone marrow, they stay there for 2-3 days, and then they will move to the circulation where they will stay for 24 hours in the reticulocyte form, and then they will be converted into the mature erythrocytes. Now, what exactly is happening in the reticulocyte stage? When reticulocytes are present inside the bone marrow, they do have mitochondria and ribosomes. But when the reticulocytes enter into the circulation, the reticulocytes lose their mitochondria and the ribosomes. Okay? So when they lose their mitochondria and the ribosomes, then all the process is complete and they finally are converted into the erythrocytes. Now, the mature erythrocytes have no nucleus, have no nucleoli, they have hemoglobin present in them, but they don't have any mitochondria and ribosomes. Okay? So these are the stages of the erythropoiesis. One interesting point, other than the nucleus, the hemoglobin, and the mitochondria and the ribosomes, are the size of the immature and the mature RBCs. So, as the RBCs are matured, their size is reduced. So, the first stage, the most immature stage, the proerythroblast, the size is 14 to 19 micrometer. Then the basophil erythroblasts are smaller as compared to proerythroblast. Their size is 12 to 17 micrometer. Then the size decreases to 12 to 15 micrometers, then decreases to 10 to 15 micrometers, then 7 to 10, and finally 6 to 7.5 micrometers. Just imagine the size of 19 micrometers and imagine the size of 6 to 7 micrometers, the mature RBCs. So mature RBCs are way smaller as compared to the immature RBCs. Okay, so the most easiest way to remember the RBCs are first of all by the names of the basophil, polychromatophil, and orthochromatic. Okay, and then the immature reticulocytes, and which will enter into the circulation, which finally will be converted into the mature erythrocytes. Okay, so these were stages of erythropoiesis, a very important topic. See you in next part.